We start with our lecture today is DIC, Disseminated Intravascular Coagulopathy. What is the definition of this phenomena? It's a hematological condition that's associated with a thrombohemorrhagic disorder. Thrombohemorrhagic disorder. Normal coagulation pathway, there is in a human body, there is a balance between the coagulation and fibrinolytic system. There is coagulation or balance between the coagulation and fibrinolytic or fibrinolysis. The coagulation will be start with initiation with formation of tissue factor and subsequent binding of factor 7 activator. Tissue factor and subsequent binding of factor 7 activator. The result is factor 10, where the prothrombin is converted to a thrombin. هذا المخطط يوضح لنا الcoagulation and fibrinolytic system. Normally there is a tissue factor and factor 7 activator will be formed factor 10, convert to factor 2 activator is a thrombin. The benefit of a thrombin is conversion of fibrinogen to fibrin. Conversion of fibrinogen to fibrin. This is the coagulation system. As we say, normal human body, there is a balance between the coagulation and the fibrinolytic system or fibrinolysis. Fibrinolysis includes this. Plasminogen will be converted to plasmin. Plasmin converted fibrin to fibrin degradation products اللي هي D dimer. If inhibitor of this plasminogen activator so that there is an adequate removal of fibrin ما راح يتحول إلى fibrin degradation ما راح تكون هذه السلسلة. إذا كان هنا عندنا inhibitor للبلازمينوجين activator بالنهاية راح يكون لنا هنا الثرومبو امبوليزم أو الثرومباي راح تكون هنا بالفيزل اللي راح تكون small and mid-size vessel. Small and mid-size vessel. These conditions will be occurred. DIC is related to cytokines. Cytokines example عليها الانترلوكين, tissue necrosis factor and endotoxin. Tissue factor, what is the tissue factor? Normally هنا موجود tissue factor هو transmembrane glycoprotein. Transmembrane glycoprotein موجود على many cell type مثل endothelial, macrophage, monocyte and other. Normally is not contact with general circulation, but when there is vascular damage, there is contact with tissue factor with general circulation when exposure to cytokines. We repeat the slide. DIC is hematological condition that's associated with a thrombohemorrhagic disorder. Thrombohemorrhagic disorder. Normally, there is a balance between the coagulation and fibrinolysis. Coagulation system is a start with formation of tissue factor and subsequent binding to factor 7 activator. Tissue factor is the transmembrane glycoprotein present normally on surface of the cell, but not contact with general circulation. When exposure to cytokines like interleukin, tumor necrosis factor, endotoxin will be exposure to general circulation. And the result is factor 10 activated, prothrombin will be converted to thrombin. The benefit of a thrombin is conversion of fibrinogen into fibrin. And the fibrinolysis, there is a plasminogen normally convert to plasmin. Plasmin convert fibrin to fibrin degradation products. When there is inhibitor to this factor, a plasminogen activator, so there is no conversion of fibrin to fibrin degradation products, and adequate removal of fibrin will be a result in a thrombosis in a small and mid-size vessel. What is the pathophysiology of DIC? أول خطوة راح يكون systemic activation of the coagulation cascade leading to extensive fibrin deposition اللي قلنا conversion of fibrinogen إلى fibrin، وهذا بمساعدة factor 2 activator اللي هو الثرومبين. بالنهاية شو يعطينا؟ مثل ما قلنا microvascular thrombosis، قلنا thrombosis بالميدل and small size vessel, microvascular thrombosis. بالنتيجة patient will be exhibit a tendency of severe bleeding. بعدها راح يصير severe bleeding associated with consumption of platelet and coagulation factors. لأنه مثل ما تحدثنا عن ال DIC definition اللي قلنا هو راح يكون hematological condition. الثرومبو بالبداية راح يكون activation coagulation system، بعدها راح يصير hemorrhagic disorder. What are the causes of DIC? DIC is a secondary phenomenon. There are non-obstetrical causes and obstetrical causes. مثل ما قلنا راح يصير دمج، بالنتيجة الدمج راح يصير exposure of tissue factor اللي موجود على السيل، على الماكروفاج، على الاندوثيليال سيل، exposure to general circulation، وينتهي لي بالactivation coagulation system and fibrinolysis will be dysregulated. هذه البالانس اللي موجودة راح يصير بيها dysregulation. What are the causes for DIC? Non-obstetrical. Example: trauma, sepsis, organ damage, transplant rejection, acute liver failure, vascular aneurysm, and other. Obstetrical causes. What are the most common obstetrical causes? Placental abruptio, 37. Postpartum bleeding, 29. Most common obstetrical causes: placental abruptio, postpartum bleeding. And there is placenta previa, HELLP syndrome, acute fatty liver, sepsis, and amniotic fluid embolism. And the last one is IUD, intrauterine fetal loss. DIC is a secondary phenomenon. There are non-obstetrical causes like tumor, sepsis, organ damage, and other. Most common obstetrical causes: placental abruptio and postpartum bleeding account 37%, while postpartum bleeding 29%. And the least one is IUD, intrauterine fetal loss. These are the causes of DIC. What are the clinical features? As we say, is a thrombohemorrhagic condition. Then start with the bleeding, usually manifest as ecchymosis, petechial, mucosal oozing, and prolonged bleeding at vein puncture and surgical incision. Also, altered mental status, acute renal failure, hypoxia, hypovolemic shock, and abdominal compartment syndrome. هنا راح يصير زيادة بالبريشر بالenclosed structure lead to organ damage or perfusion and organ function will be affected. Clinical feature: most common clinical feature: bleeding as ecchymosis, petechial, mucosal oozing, prolonged bleeding at vein puncture and incision site. And the other clinical feature: altered mental status, renal failure, hypoxia, and other. We are repeat the definition of DIC: disseminated intravascular coagulopathy, hematological condition associated with the thrombohemorrhagic disorder. Pathophysiology is systemic activation of coagulation cascade, lead to deposition of fibrin, then later on exhibit a tendency of severe bleeding associated with consumption of a platelet and coagulation factor. This is a slide will be show the tissue factor, which is a transmembrane glycoprotein present on many cells, but when not exposure to general circulation. In some cases will be exposure to general circulation and lead to this sequence: binding with factor 7 activator, formation factor 10 activator, lead to formation of factor 2 activator. Thrombin will be convert fibrinogen to fibrin. This is in the presence, this condition will be happen in the presence of cytokinase. Also, there is a plasminogen to plasmin fibrin to fibrin degradation product. When this plasminogen activator is inhibited, so that no conversion to fibrin degradation of product at the beginning, and then lead to thrombosis. Obstetrical causes and non-obstetrical causes. Most common obstetrical causes: placental abruptio and postpartum bleeding. Non-obstetrical causes: trauma, sepsis, organ damage, toxic and immunological causes. The least cause is IUD, and the other causes may be sepsis, amniotic fluid, preeclampsia, and acute fatty liver. What are the most common clinical features for DIC? Bleeding, as ecchymosis, petechial, mucosal oozing, prolonged bleeding, and other. Altered mental status, renal failure, hypovolemic shock, abdominal compartment syndrome. Answer with the following statement with true or false for the following. DIC is a systemic activation of coagulation, and furthermore, patient exhibit a tendency for severe bleeding. True or false? True. إذا أول ما بدينا صار عندنا هنا activation للcoagulation system، بعدها صار عندنا هنا severe bleeding. Very good. Thrombin is a factor 7 activator. Will be convert fibrinogen to fibrin. Thrombin convert fibrinogen to fibrin. This is true, but it is a true factor 2 activator or factor 7 activator.
دكتورة 2 activator.
Factor 2. لأن إحنا بداية الكلام مالتنا قلنا tissue factor and factor 7 activator. يعطيني factor 10 activator بعدها يعطيني factor 2 activator. Yes. The result of tissue factor and binding to factor 7 and the result of inhibiting of plasminogen converting to plasmin in helping of cytokinase or in the presence of cytokinase lead to thrombosis of large vessel. True or false? Thrombosis بالlarge vessel لو قلنا
small and mid vessel.
small and mid-sized vessel لأن احنا ايش قلنا microvascular micro مو macrovascular microvascular. Yes. The most common clinical features for DIC is hypovolemic shock.
دكتورة
bleeding.
Bleeding. The most common هي bleeding. أول ما يجينا هنا شنو عندنا most frequent clinical finding هي bleeding, ecchymosis, petechial, mucosal oozing and other. Non-obstetrical causes for DIC is trauma and sepsis, and the obstetrical causes like placental abruption and postpartum bleeding. Is it true or false?
True.
True. DIC is considered as secondary phenomenon. The non-obstetrical causes مثل trauma, sepsis, organ damage, لكن the most common obstetrical causes هي placental abruption and postpartum bleeding. Yes. We start with physiological changes in the coagulation mechanism due to pregnancy. During pregnancy احنا نعرف بالphysiological changes اللي اخذناها بالمحاضرة الأولى والثانية، قلنا انه البرجنسي هو هايبر كواجيوبل، يعني هو بطبيعته بالبرجنسي راح يصير هنا اكثر شيء شنو هنا عندنا الثرومبوسيس. ليش يصير ويانا؟ بسبب increase الفاكتور 2 7 9 10 decrease level بالثرومبين 3 and fibrinolytic activity fibrinogen level increase D dimer increase. إذن هذه هي الفسيولوجيكال تشينجز اللي راح تصير بالكواجوليشن سيستم، لذلك تخلي البرجنسي هايبر كواجيوبل، ما يكون هنا هايبر كواجيوبل. بعد ديليفري يبقى هذا الكواجيوبيليتي شفوية موجودة following delivery اللي هي period of time when the placenta is being retrieved has the highest level of thrombotic activity due to release of thromboplastic substance. Diagnosis. There is no single laboratory test to diagnose DIC. ما عندنا في الدياجنوسيس مشخص نقول هذه المشكلة تعود إلى DIC. Diagnosis depend on clinical suspicion. Depend on a clinical suspicion and supportive laboratory test. Then there is no test, a specific test. نعتمد على clinical suspicion يعني الاشتباه السريري. مثل مريضة عندنا بلاسنتال ابروبشيو، صار عندنا هنا ثرومبوسيس، بعد صار عندنا بليدنج، خليت ببالي هاي وحده من الكومبليكيشن دي اس لان قلت هي سكندري فينومينا. فاذا كلينيكال سسبشن بعد شنو يسندها؟ لابوراتوري تيست. These tests reflect only the conditions at a moment in time, so repeating it aids in establishing the diagnosis. هذا السكورينج اللي مهم for diagnosis of DIC اللي هو International Society of Thrombosis Hemostasis. International Society of Thrombosis Hemostasis scoring system to diagnose DIC. شوفوا من اسمه International Society of Thrombosis والهيموستاسيس. شو يعتمد على هذا السكورينج؟ يعتمد على عدة نقاط. الثرومبوسايت كاونت، على الدي دايمر prolongation of the pregnancy test fibrinogen level. السكور يكون هنا 5 and above is overt DIC. لما يكون هنا السكور 5 أو أكثر فهذا يعتبر هنا DIC. هنا هذا السكور. International Society of Thrombosis Hemostasis will depend on platelet count, D-dimer or fibrin degradation product, prolongation of prothrombin time, fibrinogen level. هذه السكور. كل ما يكون البليتلت كاونت قليل السكور يكون أعلى. لما يكون أقل من 50,000 إذا السكور يساوي 2. لكن الدي دايمر كل ما يكون سترونج انكريز، هو انكريز بالبرجنسي لكن سترونج انكريز، فإذا راح هنا السكور راح يكون 2. كل ما يكون البروثرومبين تايم is prolonged فالسكور راح يكون أعلى. more than 6 seconds the score is equal to 2. لكن لما يكون low level of fibrinogen less than 1 the score is 1. فلو كانت البيشنت عندنا البليتلت كاونت less than 50,000 يعني 2 and D-dimer is very strong increase 2 إذا حصلنا على 4 بالسكور. prolongation of prothrombin time لقينا هنا مثل 7 second أكثر من 6 إذا صار 2 صار عندي 6 هنا. fibrinogen level أقل من 1 لقيته صار عندي 7 إذا السكور إيش قد صار هنا equal or more than 5 this is mean over DIC معناها DIC علني بعد ما بيها مجال ما عندنا خط رجعة. لما يكون هنا أجمع السكور يكون أكثر من 5 أو يساوي 5 يعني لي over DIC. لكن إذا لما جينا للبيشنت نفترض هنا البليتلت كاونت كان هنا السكور مالتها 1 الدي دايمر 1 السكور prolongation of prothrombin time also هنا مثل نفترض 2 فصار هنا 1 ب2 صار 4. هنا الفيبرينوجين level more than 1 إذا هنا 0 صارت 4. فصار هنا repeated daily if less than 5. إذا كانت هذه المريضة السكور حصلنا على 4 يعني أقل من 5 يفترض باليوم الثاني نعيد هذه اللابوراتوري تيست حتى نتأكد إنه لأنه قلنا راح يعطيني الفكرة عن الدي آي سي at moment of time وقت الفحص مالتنا يعطينا. إذا هسه diagnosis of the DIC will be depend on clinical suspicion الاشتباه السرير and supportive laboratory test. Laboratory test will be depend on platelet count, D-dimer, prolongation of prothrombin time, fibrinogen. كل ما يكون السكور نحصله more than or equal to 5 this is mean over DIC. DIC علينا بعد ما إلى خط رجعة. لكن إذا كان السكور less than 5 so that will be repeated daily. These laboratory tests must be repeated daily. And as we say DIC is secondary phenomena so that will no single laboratory test for the condition. Treatment. As we say treatment, this is secondary phenomena. There is involved the thrombosis with small and micro medium size vessel. بعدها راح يصير bleeding. فإذا نحتاج ل treatment team involve obstetrician, physician, hematologist and anesthetic. The main goal of treatment is correct the underlying obstetrical causes. إذا كانت المريضة هنا obstetric فلازم إنه treatment of obstetrical مريضة بلاسنتال abruption. ما معقولة أنا أنشغل بالدي آي سي وأترك الدليفري مالتها. إنه لازم المود of delivery و termination of pregnancy. فإذا هنا correct underlying obstetrical cause. Besides that, supportive treatment should be implemented. لازم أنفذ supportive treatment اللي هي corrective coagulation disorder. إذا the treatment will be depend on team involve obstetrician, physician, hematologist, anesthetic. Main goal of treatment correction the underlying obstetrical cause. Beside that, correction of coagulation disorder. Beside that, will be correct the coagulation disorder. Answer with the true or false for the following statement. Pregnancy is hypocoagulable state.
False.
False. There is a single laboratory test to diagnose DIC because it is a secondary phenomena.
False.
False. No single laboratory test. The diagnosis of DIC is based on clinical suspicion and supportive laboratory tests.
True.
True.
Yes, very good. Interstitial Society of Thrombosis and Hemostasis develop a scoring system for diagnosis of placental abruptio.
False.
False for diagnosis of DIC. Scoring system ISTH scoring system is based on a thrombocyte and D-dimer only.
False.
False. Depend on thrombocyte يعني البليتلت count, D-dimer, prolongation of prothrombin 10 and fibrinogen level. When the score is equal to 4, so that repeated daily to get to diagnosis of DIC.
True.
True. لما يكون أقل من 5 repeated daily. When the score is 6, this is mean overt DIC. When the score is equal to 6,
5.
mean
False.
overt DIC.
True.
False. False هو 5.
السكور لما يكون more than or equal to 5.
نعم.
لو ننتبه عليها لما يكون هنا more than or equal to 5 هذه equal to 5 or more than 5. فلما يكون هنا 6 السكور معناه هذه overt DIC. لكن لما يكون أقل من 5 إذن هذا repeated daily to get to diagnosis. Okay. Treatment of DIC. Treatment of DIC involve team, obstetrician, physician, hematologist, anesthetic. B, need to correct underlying obstetrical cause. 3, must be correct the coagulation disorders. D, all of the above. Which statement is true?
All of above.
D, all of them is all of the above. لأنه الفيرست one قلنا need team involve obstetrician, physician, hematologist, anesthetic. Second, correct underlying obstetrical cause. Third, correct coagulation disorder. Fourth, will be all of the above. Okay. A treatment of DIC as replacement of blood and blood products. هذه السلايدات ايش كم سلايد بقى عندنا؟ حوالي 3 سلايدات. هو راح يتحدث عن how to correct coagulation اللي هي هنا replacement of blood and blood products. فقد يكون whole blood. whole blood هذه الباينت of blood اللي هو contain 500 ml. هنا لما نعوضه للبيشنت نعطيه ايش قد راح يزيد السيرم فايبرينوجين by 12.5 ملغ بر ديسيلتر. platelet count ايش قد يزيدها؟ حوالي 10,000 to 15,000 cells. إذن أول treatment بالدي آي سي هي whole blood. whole blood 1 pint اللي هو 500 ml will be increased fibrinogen 12.5 ملغ per deciliter and increase the platelet count by 10,000 to 15,000 cells. Second is a platelet suspension. Platelet suspension. This is administered to patient with a platelet count less than 50. إذا كانت البيشنت platelet count أقل من 50 وعندها active bleeding أنطيها platelet. وإذا كانت البيشنت ما عندها bleeding لكن لما نيجي هنا للبليتلت count إيش قد تكون أقل من 30 أيضا indicated for a platelet suspension. 1 pint of platelet إيش قد يحتوي على 50 ml. 50 ml. Increase the platelet count by 5,000 to 10,000 cells. By 5,000 to 10,000 cells. Then we are repeat. Treatment, blood, whole blood, contain 500 ml, increase fibrinogen level and increase the platelet count. Second, platelet suspension, when the platelet is patient, platelet count less than 50 and active bleeding, ممكن أنطيها أعوضها بالبليتلت سسبشن. لكن لما تكون البيشنت بليتلت كاونت أقل من 30 لكنه ما عندها بليدنج no bleeding مع ذلك أنطيها البليتلت سسبشن. ال 1 pint of platelet contain 5 ml, increase the platelet count by 5,000 to 10,000. Fresh frozen plasma. Fresh frozen plasma. Administered if active bleeding occurs in the setting of a prolonged prothrombin time and activated partial thromboplastin time. إذا لما يكون هنا prolongation للمريضة بالبليتلت البروثرومبين and activated partial thromboplastin time، إذا نحتاج عندها active bleeding أحتاج أنطيها fresh frozen plasma. إيش قد الدوز؟ 10 to 20 ml per kg. 1 pint of fresh frozen plasma contain 250 ml. 250 ml. إذا 4 pint of fresh frozen plasma إيش قد يساوي؟ 1 liter will be increase serum fibrinogen by 5 to 10 milligram per deciliter. Okay, fresh frozen plasma في patient at active bleeding condition prolonged prothrombin time and activated partial thromboplastin time. 1 pint of fresh frozen plasma 250 ml. إذا 4 pint will be increase serum fibrinogen by 5 to 10 milligram per deciliter. Non-activated prothrombin complex concentrate indicate if fresh frozen plasma are not feasible. إذا كان هنا بسبب إن overload of the fluid and fresh frozen plasma is not feasible، غير ممكن إنه أنطيه، فأنطيه non-activated prothrombin complex concentrate. أيضا in congenital isolated fibrinogen deficiency لما يكون fibrinogen less than 1 gram cryoprecipitate or fibrinogen concentrate should be used. Since the fibrinogen consumption may be faster, fibrinogen concentrate may be administered with value above 1 gram per 1 liter in DIC. Usually the cryoprecipitate 1 pint contain 40 ml, 2 pint will be increased fibrinogen by 1 gram. We are repeat the replacement of the blood and the blood products. Whole blood contain 500 ml, lead to increase serum fibrinogen and platelet count. 500 ml يحتوي على يزيد الفبرينوجين 12.5 ملغ، platelet count 10,000 إلى 15,000. Platelet suspicion اللي هو contain 50 ml will be increased platelet count by 5,000 to 10,000. At which time will be administered when the patient is actively bleeding and the platelet count less than 50, or patient without bleeding and the platelet count يكون هنا less than 30. Fresh frozen plasma 1 pint equal to 250 ml. 4 pint will be increased serum fibrinogen administered if there is active bleeding and setting of a prolonged prothrombin time and activated partial thromboplastin time. Non-activated prothrombin complex concentrate, fibrinogen concentrate, or cryoprecipitate administered in congenital isolated deficiencies. Cryoprecipitate 1 pint contain 40 ml. 2 pint will be increased serum fibrinogen by 1 gram. Okay, answer with true or false for the following statement. As a part of the treatment of DIC, whole blood will be contain 500 ml, lead to increase in serum fibrinogen and platelet count.
True.
True. Yes, very good, very good. Cryoprecipitate 1 pint of cryoprecipitate contain 40 ml. 2 pint will be increased serum fibrinogen by 10 gram per liter.
False. 1 gram.
1 gram ما زيد إنه 10 gram. Okay. In congenital isolated fibrinogen deficiencies, patient congenital isolated fibrinogen deficiencies, cryoprecipitate should be used.
True.
True. هي أصلاً عندها deficiency، إذا راح أعطيها أنا cryoprecipitate. Yes, very good. 4 pint of a fresh frozen plasma will be increased serum fibrinogen
True.
by 5 to 10 milligram per deciliter. True. Yes, very good. In patient without bleeding and platelet less than 30, indicate platelet suspicion.
True.
True.
True. In patient with the bleeding and the platelet count less than 50, platelet suspicion is indicated.
True.
True. Very good. أوكي، واضحة المحاضرة إن شاء الله، سهلة عليكم؟
واضحة إن شاء الله دكتور.
يلا، شكرا جزيلا لكم، ولو عندكم أنتم محاضرة الساعة 11، شكرا جزيلا لحضوركم، موفقين إن شاء الله.
شكرا.